if you're a practitioner, then how do you diagnose your patient? As an acupuncturist and Chinese medicine doctor, do you diagnose your patient by looking at the tongue or take the pulse, or by asking the question? How do you properly diagnose it? So this is something that we need to discuss today. Hi Mark, how are you? On Instagram, thank you for joining us. So if you on this live video, please say hello to me. I can see that someone on YouTube and Instagram, please say hi to me. Then wave with me and wave to me. Good. Glad that you say good. where about are you, Mark? And share this video as well. Share it on your social media, please. And if you're on YouTube, please, when we finish this, and take the link and share on the social media. Thank you very much. All right. Hi Hassan, nice to meet you. Good morning. Veronica, good morning. Thank you. Oh, no problem. Thank you. From India, great. All right. Now our topic today is how to diagnose PCOS. So as a practitioner, how do you diagnose it? If you're a patient, then how does your doctor actually diagnose you? Okay, so there is some misunderstanding and misdiagnose in PCOS, and I'll let you know why, how. Okay. Let's go through how to proper a normal doctor and how they diagnose you. Okay, now we know we've been talking about PCOS. Is number one thing is in blood tests. If you want to get diagnosed, one of thing is blood test, ultrasound, right? And by asking the question. Well, the physical examination, when a patient comes to you, yes, you can perform a pelvic exam, but for me, I don't do it because there's no point for me to do it, because most patients come in, they have the diagnosis already. They have the diagnosis with PCOS already. Okay. And then what happened in here is, then what should we ask the patient? The first thing you ask the patient is whether they get regular period, menstruation. Right. This is the first thing that you want to find out. Right. Then the patient may say, well, I've got my period, I missed my period, I got it for, I sometimes get it, sometimes not. It's not regular. Then here you go. Number one, irregular menstrual cycle. That's what you want to hear if you want to diagnose PCOS. Okay. And then you ask them, do you have any blood tests? Yes, they have blood tests. Then you want to get out the blood test, look at the blood test, and show that the androgen, which is a male hormone, is high. Then the female hormones low. The female hormones low. FSH, LH, and estrogen. Okay, those are low. Then high androgen levels in the second one. And the last one is, we can't do it in our clinic, is ultrasound skin. In ultrasound, they be able to see cysts in the ovaries. It can be on one side, can be on both sides, right? Can be multiple, can be few. Some of them can be very big, and those big ones can cause pain. It can cause pain. So those are three things that any of those two or three symptoms, those are the main three. Okay. Ultrasound skin, that they can see cysts in the ovaries, high androgen level, which is from blood tests, and irregular menstrual cycles. I want to point out, people say that any of those two, but when it comes to PCOS, you want to diagnose PCOS, the first one is you must get cysts in the ovaries. Cysts in the ovaries. Without this one, you can't diagnose PCOS. You see what I mean? Because I have patients come in, they say, well, I suffer from PCOS. Now I say, well, who diagnosed it? Oh, I have skin. You know, and my doctor said that. Okay, that's good. Then let me see all the results. Then I look at it. All right. In this ultrasound skin, they have cysts. Take one. And ask about menstruation. Well, irregular. Take two. And hormone level of balance. 3. Right? You are PCOS. Right? Because PCOS symptoms mean more than two or more than two, and that is symptoms, right? Now, in some cases, you may find they only have cysts and they don't have symptoms, no other symptom. You ask them, what is your period? Oh, my period is regular, 28 days. Okay, 28 days period. Yes, the ultrasound said that showing that it's cysts in the ovaries. Then by asking a patient about the period cycle, it's normal. It's been normal, no problem. Then look at the blood test. Well, pretty okay. The blood test was pretty okay. The hormone pretty okay, not out of balance. So then you look at the patient, and the patient change the diet, and they're pretty slim. It's not getting any weight. It's not put on weight at all. They're not hairy, you know, no acne. Okay. They don't have any other symptom that's showing that they have PCOS. So in this case, the diagnosis is wrong. It's not PCOS. It's actually PCO, polycystic ovary. They have cysts in the ovaries. It can be from the past. Many years ago, they missed some period, so it didn't release the egg, and those egg follicle become a few sacs on the ovaries, and that become cysts in the ovaries, right? Become cysts. Then therefore the period back to normal, or they were on the pill. You know, most people on pill, they will get fat, they put on weight, but some people they won't, and then they miss a period, and that's how it got to the cyst. Then after they stop the period pill, or some other reason, back to normal, and they exercise and eat well, and everything's pretty good, and they got regular period. and no longer have those symptoms. Skip here. Right? And because of the short time of the miss out period, by the time they had it, they have irregular hormones, irregular menstruation. But it turned, and then it got better. Or they stop the pill or stop other whatever they do that causing the irregular period. But the cysts remain in the ovaries. So when they come to see you, we have some patients like they come to see us. Yes, they find it difficult to get pregnant in trying. So what happened is they got an ultrasound and showed they have PCO. And then the doctors tell them that they have PCOS, or they just go for online and they say, oh, I have PCOS. And when you ask for everything, so as a practitioner, you need to know how to diagnose. And you just tell the patient, well, you have PCO, not PCOS, because you don't have any other symptoms. That happened. But of course, majority of the patients come to you when they have PCOS, they do have PCOS. Okay. Now, and there's another type of patient. I've seen that too. They come in, you ask the question, they have irregular menstruations, they have hair growth in the bodies, like here, chest, on the tummy, or the back. They have acne, they put on weight. Wow. This symptom, wow, it looks like PCOS symptom, right? Common symptom. It looks like it. And they may have high blood pressure, high blood sugar. Now we talked about this common symptom yesterday. Metabolic symptom. High blood pressure, high blood sugar, high cholesterol. Okay. And maybe depression and anxiety. It look like they have PCOS, but unfortunately, they are not PCOS patient. And the hormone, it does out of balance. They checked the blood test, it did show out of balance, but in the ultrasound skin results, when you look at it, there has no cyst in the ovaries. No cyst in the ovaries. Well, that happened. We have some patients with no cyst in the ovaries, but they have all the symptoms, which means we can't explain it. It seems like they don't release the eggs, but there is no cyst. Maybe this is absorbers. We don't know. Yet we have few cases like this. But again, majority of people come to you, they have PCOS, they have PCOS. But there are some cases, they look like PCOS, but they don't have cysts. So without cysts, then you can't diagnose PCOS. Right? Because PCO is polycystic ovaries. Does it make sense to you? Right? I hope this makes sense. Anderson, a big hello from Dr. Sinan. Thanks for keeping us teaching. You're welcome. Hi, happy day. How are you? Okay, thank you for saying hello to me. So this is something that I will share today. It's so simple and some experience. But if you check on Dr. Google, you may find out what all people said about any of the 2 symptoms out of 3, then you'll be able to diagnose PCOS. But I don't think all the information on Google is right, but the majority is right. Okay, so you have to think about it, and not everything online is right. Okay, that's it for today. And remember, I want to show you a summary, right? So if you want to diagnose PCOS, if you suffer from PCOS, at least 2 things out of the main 3 symptoms. Number 1 is mass, like ultrasound scans show the cysts in the ovaries, and then either one of the following, which is high a blood test showing that high androgen levels and irregular periods. Okay, they may have other symptoms like put on weight, acne, extra hair grow on your face, and chest and tummy or back. They may have high blood pressure, high blood sugar, metabolic symptom, high cholesterol, all this thing. Also, they may have this patient may have what do you call that? Depression and anxiety. Okay, depression and anxiety are pretty high risk to develop the sleep apnea as well. Okay, and heavy bleeding when they have period, and get lost here, you know, and headaches, and the skin conditions like darkening of the skin in the skin area, under the breast, all this thing that we mentioned, and in the groin as well. So all this thing we mentioned about the other days, like the common symptom of PCOS, yeah. So this can help us to diagnose PCOS properly. But the first thing first is the skin, ultrasound skin to show cysts in the ovaries, right? And any of the other 2, which is high androgen level on blood test and irregular menstruation. That's it. Simple. You just need to have this idea. So if patient come to you, if a practitioner, if patient come to you have irregular period, don't just give them a diagnosis, because you need to ask them. You need to ask them to go for an ultrasound scan and get a blood test. When an ultrasound scan came back, blood test results came back, and therefore you can make a proper diagnosis. You can't just go with symptoms and you have PCOS symptom. That's it, you are PCOS. No, don't do that, because the ultrasound scan came back, maybe there is no cyst in the ovaries, so you can't make the diagnosis. You can only make the diagnosis, it's hormone out of balance, causing all the symptoms and miss your period, but there's no cyst, right? Does it make sense? Okay, so this is something that we see it often in our clinic, especially when it comes to infertility case. Hi Alison, how are you? Good morning. All right, next thing is tomorrow we're going to talk about pregnancy and PCOS. Then slowly we're going to put down to diet and lifestyle tips to treat PCOS. You know, what sort of lifestyle you can treat, what sort of diet is best for PCOS. Then we're going to talk about the common medication for treatment. The common medication treatment is talking about the Western medicines. So Western medicine for so it's pretty simple, because if you know what's causing it, we talk about it, the 3 main reasons. So from there we talk about how to prevent it, how to change diet, and then do medication, right? Then we're going to talk about acupuncture treatment for PCOS. When it comes to acupuncture, I'm going to give you some strategy for some acupuncture point, and some formula of Chinese medicines, for it. What else? Something like that. So we have pretty much another 5 days. So we finish it next week. Every morning we talk about a little bit, and to feed you a little bit of information. Okay, I hope all this help and we learn together, and that's cool. It makes sense. Thank you, Veronica. A woman with irregular period cannot have PCOS, is that right? Yeah. Yep, you're right. So a woman who have irregular period, you can't diagnose PCOS, Anderson. You can't diagnose in this PCOS, because irregular period doesn't mean it's PCOS. Irregular period is one of the symptoms of PCOS, but they really want to get a ultrasound skin, right? Ultrasound, because a lot of irregular period, it may just irregular, nothing to do with PCOS, nothing to do with cysts in the ovaries. You can't put it to like, well, irregular period equal PCOS. That's not right. Okay. And even though they have symptoms, as I was mentioned, extra hair growth or this thing, it can't say that they have PCOS, because you really want to get the ultrasound results to be able to tell. Does that make sense? Okay, I think we here. Is there any question? You're allowed to ask question if you wanted to. If there's no question, then we're gonna finish this live, and thank you for being here with me. Let me wait for a little while. Okay. Right. I'll close out some of the platform, and I'll keep the Facebook going for a while. If you have questions, you can ask. I'm happy to share anything I know.